Okay,
So it says problem set 3D tomorrow, that's wrong, I think that's fine. I just made that last thing. Now, today we're going to get today we're just going to run through the basic concept of research strategies. What I'm going to highlight today, when possible, is that when we take this on for the first time, what I'm going to highlight is that these studies can be used in extra form processes. We'll talk about this and finish up with this at the end, but with a lot of the basis around policy arguments and disagreements. There's also this value in the system that we started yesterday. Right, there's no regression analysis that's capacity work. No, that's not what regression analysis is. But even in all of those ways, there's elements of it, conventions of it, informed by quantitative empirical studies that sort of anchor our understandings now and anchor our conversations. Stop that. All right, and they can inform how we discuss the most important political and pressing issues today. They will not resolve moral argument. What they will do is make sure that the moral argument stay relatively tethered in something that's justifiable. So it limits the debate and stop people from wandering too far off something that can show up there through the path. We're going to start off today talking about this really wonderful paper from 2 years ago now. Parochialism, social norms, and discrimination estimated. This was a rather fascinating field experiment that was conducted in Germany. Now, I believe through to today, but certainly back in 2016 on, the most pressing question that's coming across pretty much all of Europe is how to handle immigrants and refugees. This is the most pressing political question. Different countries have their own particular approach concerns, but across all of Europe, this is a big question across all. I was in a couple of them, Sweden in particular, and people were telling me roughly in order just the capitals, calories, after talks and stuff. They tell me rents are expensive, and they talk about refugees. Right? It's just like a serious issue across the country. So the question of what European countries owe other people is a different conversation. So that's that. What we're going to look at in this study is a mechanism of incorporation. And I just wanted a few days ago from one of undergrad, I think using the word assimilation for immigration refugees, and we call that incorporation in our word. And I think I agree. There's bigger conversations there with one and right. That's something that today we're definitely talking about. So we're talking about the incorporation of refugees into relatively homogeneous populations of people in this case. The nature in Germany has literally had riots over refugee policy. So these are big issues there. What these authors wanted to know is what is it about incorporation of immigrants and refugees into these countries that allows for acceptance by the dominant ethnic group. So this study was just absolutely fascinating. It was not a Tennessee, it was not a Tennessee platform. They randomized the trades and randomized everything, right? The way it works in Berlin, never been. Okay. I've heard there's a really strong one. Of course, there's a really strong one of that paper. Is that true? That's not. That's what the paper posits. I've never been. Yeah. Okay. Which makes it exactly like Philadelphia University. I was really sorry. Sorry, I shouldn't. So there's a moment that's good. So what is that? was up there, had a fellow in class A, finish a coffee cup, finish a cup of coffee, just remember. Person B either enforced the norm and said, hey, you need to throw that away, or said nothing. So they enforced the norm or not. Then person B out there spills oranges. Destructive dead oranges. And the outcome is whether the people watching help person B pick up oranges. Right? What I like about this is it's getting something deep about cultural interactions, much more so. It's talking about reciprocity. And it's getting something deeper about cultural interactions than simply what do you think of people on a scale, where it's actually do you help people pick up? Do you help people? Right? So what's randomized? Lots of things are randomized, where the platforms are, the times of day, that sort of thing. And the folks taking the pictures and watching it on the other side of the platform obviously weren't sitting there, you know, like with a video camera. You weren't being studied, right? All the good things we've talked about. What's varied is the woman who either enforced the norm or not, subsequently dropped their points. Here are the 4 different treatment conditions. So, the treatment conditions, so this is one who either enforced the norm or not, and then drops the oranges, and the outcomes does some help her. Things different things with how many people help her, that sort of thing, results are kind of qualitative. So the 4 different people that we found on the platform play after this with all the toxic and range from going from left to right. There's an immigrant with a new job. Okay. Stereotypical, let's look at one stereotypical most American parts of the East. Is that I don't want to miss you. Is that fair? Maybe. Okay. But she's learning a new job, which is not made, it's not a part of the ancestral group, right? Then there's the immigrant control group, which is the same woman, just not there in the job. So look at the woman's features, I would say she's never training or really her mother, so she still has that sort of look. The third treatment condition is wearing gloves. So the first condition is saying, hey, I don't practice the muscle. The second one is saying, I look like I come from a certain region of the world where lots of refugees and immigrants come from. The third one is saying, I'm actually a practicing Christian. That's what the sort of the crucifix signifies. And then there's a native control group, which is a white church. Everyone sort of see this level? Okay. So just to refresh, there's a guy standing over a cup of coffee, finishes it, goes down there. One of these 4 women says, hey, pick that up, signaling compliance with ground rules of the world. Or says nothing. The woman that drops it oranges. The question is, do people help the ground rules? Cool. So let's look at the results that came out of this. This is the first round of results that we get from this study. And I like the presentation of this too. So rather, and not surprisingly, if we just look at the level of assistance offered to teachers, the native looking German speaker, the native looking German woman, 78% of the attention. Then the immigrant looked across and the immigrants in the control group, so no cross and the child, are right around the same. Maybe lower, that's the distance. But just eyeballing it, not working lower, roughly the same. If anything is lower than less louder. Then the immigrant with the child goes down quite a bit. In this case, she only gets aided 66.3% of the time versus 78.3% of the time in the German. So what we're findings that it's more complaints before. The assistants really consider which jury for the really help the stranger based off of appearance. According to this study, the results seem to indicate that they're going to do so long as at a reasonable level, 66% is still higher than at university. But no lower than the jury. So the key child is recognized, and I thought it was interesting that the Fox was also using the so we see that. Now here comes the promising story, maybe? I don't know exactly. I don't want to make moral judgments in this. Now we're going to look at the difference of whether people get help, get assistance, based on whether they enforce the outcome. So what we see up here is the German woman, the native German woman who enforces norms, gets help most often, 82%. Right? Then the native German woman who doesn't enforce norms, disregards the problem about this from only gets helped 73.5%. That difference is statistically significant. How do we know? You see how we broke apart about it is level? That's what one means. So if you have less than 0.05, if a native German woman appears to enforce the norms before our legal assistance. Now, the immigrant with the job, remember she's the lowest level before. The immigrant with the job enforces the norm. It's about the same level of assistance as the native German woman didn't enforce it. So it appears that for people in Germany who look different to native Berliners, particularly single enforcing the norms of Berlin leads to more acceptance of Berlin. And I think I found some positivity in this story, but I just think people who don't, based on the fact that difference exists in the first place. Regardless of how you read that result, it's getting something important about culture. But the last one is the immigrants who shot the best. And in fact, that's the lowest level of power over any. So perhaps the first promising story is if the immigrant with the job engages in the local arts, keeping her clean, she's more likely to be helped by strangers, assisted by strangers, 12% plus, which is a pretty sizable increase. People notice these things. The second result is that the immigrants with the teach out forces is about the same as the German justice force. Okay. That just is exactly the same, no? But there is some message here about practicing norms to be successful corporate. It does suggest that the extent to which refugees and immigrants are incorporated into, at least for the possibly European and progressive American, broader American societies, can be affected through moral adoption. Okay, and the more so it's involved in the culture, they have a lot of this. Okay. The last, that was an example of a field experiment. We talked about field experiments. I just wanted to go over one example of that. And we actually really got to investigate groups. And we want to figure out the effect of intervention on other groups. And we go through the math of countries together. So the question we're looking at, anyone having one this one? Oh, okay. I thought it was quick. It's now you said there was someone just starting med school, so we're using a PhD in a lot of this. twins or something, right? And something like that. Okay. So, but it's really reported that as the report. So what we want to know is, are female surgeons at a disadvantage when it comes to referrals relative to male? Because as a practicing surgeon, you rely on referrals from primary care. So for those of you in the US healthcare system, you have a primary care physician, you go to the doctor. The doctor says, hey, your heart doesn't work. You need a heart surgery. And then they refer you to a surgeon, the primary care physician actually has some say in who is referrals he does. And that's business for surgeons, right? There's differential referrals. So what we want to know is there a female surgeon that is disadvantaged relative to hospital? So how do we figure this out? Well, what we're going to do is for every male doctor who had a patient die within 7 days of surgery, right? So the male doctor does a surgery within 7 days of the person dies. These are hard surgeries we're looking at. Find an observation similar in education, similar in age, similar in experience, and also have something within 7 days. And we're going to pair those people up, and then just look at the different people. Okay. So, this is another course of exact matching, where you take variables like age, you just split it into 5 categories, take lots of expectations, split it into 5 categories, experience, and you split everything into different numbers of categories. And then within each category, that's you just match that. So we match exactly on the surgeon specialty, the procedure being performed, the patient's gender and morbid status, which was abbreviated into white versus non-white. Okay. Other variables have been divided into bits and surgeons are matching crossroads. So what we do is compare the number of growth. What I want to highlight in this discussion is the internal external view, the distinction that's going to come into play. So this is looking at this table is a balance table looking at unmatched data. And you want to know are there differences? And looking at them, just look at the total number of patients between male and female surgeons. Male surgeons on average get more patients, have a higher frequency of bad events, have about the same frequency of good events, but it's statistically significant. Primary care physicians referring is higher for males. Male surgeons tend to get riskier patients. Have a lower proportion of female patients, fewer minority patients, and age and background a little bit better. Also, the surgeon abilities. This is with 152,000 males and 30,000 folks with that target. So what this is telling us is we can't directly compare males because they differ on all these characteristics. And this is going to motivate match. So let's go through this and take a look and see what happens after we do the matching. Paying some attention down here to the number of observations. So before we go through this balance table, we go from 152,000 and 30,000 here to 7,757 and 7,757. That's the first line I want to draw your attention to. So what happened? If there was a male with no match, right? So really, our statement in infertility drugs is a matter of our statement is about all the male surgeons. It's about all the male surgeons for whom we contact. Right? Is that okay? First, is that okay? That is up to you, it's up to you, it's up to the researcher, that sort of. But the argument is either way. One scholar may look at this and go, I'm more concerned about the internal validity of our match sample. So I want an estimate that's correct on some sample. Someone else may come along and say, well, this sample that we're able to catch is kind of fast. And I don't know how to extend from the sample that we found to the broader population so the result is negative. Okay. There was a paper that touched on these issues. The sample on the puzzle estimate of the match sample is called the local average treatment effect because it's local to who you have. And there was a back and forth and some popular photos, on this very question. And the paper that reported that arguing to do this sort of analysis was kind of better than not. Arguing in this case, this is the only way to draw credible inference, so let's do it here. The other paper argued that's not very useful because so these sorts of questions really become complaint studies. So there's 7,757 matched surgeons. They had multiple events, so there's 5,579 surgeons for males, 3,561 for the females, which means that multiple females are matched to this multiple to males. That's fine. Now let's compare, but the reason we did this, let's take a look at the balance table now. The balance table, we can match sample for that outcomes. So let's compare the two. In the original data, all these p-values are less than 0.05. Most of them are below 0.01. In this table, all the p-values are above 0.5. Some are 0.17, some are 0.13. But this looks like the balance table. At least on average, in this matched outside data, the control group and the treatment group are broadly similar on observable variance. So this isn't exactly this is experimental data. But if you were to run an experiment, this is what we did with the program variables. Whenever you see a matching exercise, you can ask for some unobserved variables, so surgery probably that is not in this data. And that's the precedence of these. But at least in this case, we're able to get a better match. Let's take a look at the results and see what we get. So the left figure so the left figure has the placebo group are surgeons who didn't have surgery. Okay. That should not be checked. The dark group, the male surgeons are the ones who had adverse events. And let's focus on the male surgeons first, and then we'll go into the females. So if you take a look at figure A, if there was an adverse event on day 0, there's a definite decline, and it goes to a positive in referrals for those surgeons. Those who had the placebo group that had no that was actually above the ones that. Now, let's look at what that for females. That's on the right-hand side. The placebo for women, the placebo condition for women are women who successfully completed surgery for 5 to 7 days. And what you notice is it follows the same general trend as placebo now. Right? But if a woman, a female surgeon has a surgery within 5 to 7 days, the results come. And I think you can see that on the right-hand side, right? So this is a empirical slide like that. A few critiques is only restricted to the subsample we have to be able to match this data, which shows about that. I think there is some reversal. And what makes it compelling as empirical arguments that we're able to do this rational sort of keeping them similar. So we think that they will only work. And it's less about this particular study, more about the sort of research plan you might be interested in doing. And how to do this. An important part of this particular analysis is the fact that the placebo groups were recommended for about the same. That just shows that the referral rate is actually not gender, there doesn't appear to be gender discrimination in this group of surgeons for people who don't have adverse surgeries or successful surgeries, but the women is the last one. Cool. Let's see. Okay. This is a regression table. You're almost certainly going to see a regression table on your final. That's the whole point of this slide. Well, all right. We spent a lot of time on causal approaches for this population. And I tried not to downplay the they're genuinely important for understanding the way the world is. So what we're going to focus on right now is just a previous business study, our American sort of less tolerant. We see a lot of key risk factors of bringing odds to do that cause. And there seems to be some political to do where some folks are believing that freedom of speech is built up and it's all. Is that all the way to describe the occasional protocol? Does it kind of have this kind of surgery? No? Yeah. Okay. That's my mind. There's a cool sort of pops up. So this is just asking a very simple question to inform those people. And the first one is, are Americans growing less tolerant? This is from the General Social Survey, which actually goes back to the x-axis block. I think they're in the 70s. And it's just been asking the same question to Americans over the entire time frame. Every couple of years, just asks the same questions. So the question, this data comes from 2016, who should be allowed to speak? 1973 to 2016. So what you'll notice is that through averaging over all Americans, if across all groups, communists, big sets of who should be allowed to speak, the rate for communists went up and about the law, militarists have been going up. Anti-theists have been going up, but this is atheists. Homosexuals, that's been going up. That used to be in the mid-60s, now it's around 90%. And racists have been going down. There have been once and for all with the racists. I didn't look at racists in there. So then, in this case, the question that I have though is there a trend in social trend towards not allowing speakers by either political ideology or education? Now, whether people should be allowed to speak, I've had these conversations, I won't have them with you right now, but like it's a conversation, they're philosophical, they're important, or what do we expect, what extent do we allow free speech or open speech, etc. Speech, all this, right? That. We're simply asking what is the trend in support of public speaking by ideology and made by education. Okay. When taking those same groups from communists to anti-theists, extreme liberals have been going out with all those numbers ranging from 0.6 to 0.9 or so. The liberals and slightly liberal people are okay if they don't want liberals to talk. They don't want racists to speak. Going through the moderates and slightly conservatives and conservatives, what I want to know is that the extremely conservatives are, as a group on average, less supportive of free speech. That's not a wrong one from my side. that really is just validation and survey data. So what we asked next was, does this bring about education? So doing that, are college-educated citizens growing less tolerant? And this figure helps us get that. So the lines show the anti-American Muslim clergy and theological speech, right? This goes from 2008 to 2017. You can find this data online just a little bit. And what you'll notice is, to my eyes, there's been, I broke it down by college plus, high school, and rest of high school. Does anyone see a word or focus in the at least in the macro? I don't. It's, I mean, just that's just as wide as the numbers in the box. So, if anything, college-educated people are more supportive of anti-American Muslim clergymen giving speeches. Those with the high school who just a level shift down there. I don't see a time trend here at all if everyone else does. Now, let's look and see if racists should be allowed to make speeches on campus. And I don't hesitate to say that. No, I'm serious. That's sort of a mandatory. They have most of the thing? Okay. I don't want to get into it. That's what I'm okay. So what's happening? We're doing the same thing about whether racists should be allowed to make speeches. And actually, that number has been growing trending. Would you say it's trending down in college? Yeah, that looks like a number trend. So maybe there's evidence of that. For high school educated, it's about flat. And for less than high school, it seems to be flat, which is kind of popular. Yeah. So I think did I have one more of these? Let me just check real quick. No. So what are the takeaways from this? On questions, the question of freedom speech and engaging with different values of but what we can do is look at surveys. This is survey campus to see people's opinions. At least according to this, over the whole US, extreme liberals are particularly open to more speakers, higher than conservatives. This is 2016. And there seems to be some noticeable downward trend in college-educated people being happy with racist speeches. But the level is still above high school educated high school. Now, none of this actually resolves the issue. We should be allowed to speak out of campus, but we talk about broader social trends. This is just put some numbers in some of these things. It's not like the support of racist students, like 3-4% of students less. Right? It's turning down maybe a little bit. But we need to know that it hasn't been a precipitous drop. All right. Okay, so finishing up. The final. Rather happily looking for some Saturday night. You know the race, right? So we have a Saturday night, one way or another. Phone numbers in the 5 minutes, and the dean comes out and says, hey, no one person finals Saturday night. Absent that, I'm going to pay my year and let you know if it is up. I really don't. If everybody gets like, oh, but I'm just going to abide by the university back. All right, okay, that's that. So we're just going to abide by the university guidelines on all of that. And waiting for guidance from both. It'll be either in here in person, that's what the registrar has. Otherwise, it won't. It'll be, I think, was it 30% local over 15? 15, that's a kind of 60 for 25%. We're going 5%. Sorry. That's 15%. And open book exam because that's not right. This slide I started putting together, right? It's gonna be a quiz with 18 questions, 16 questions instead of 12. I know in person, but we know that without the advance, you'll take the paper with the advance, so you'll fresh out, you'll exercise, about cognitive, values. If it's an experiment, once again, I'll interpret it. Cool. All right. That's gonna be the fun. It's a quiz with 16 or 18 questions. We're working that out. A few regressions, interpret the figures, or letter grades, just close to your letter grades are this is that last column. So sorry, you can see your number grades. I'll let you know where the A's and top off is before the final, so you'll read this one. Cool. So the last part of it, and this part is important. On these things, I please all of your grades. As is. Does that make sense? So if your preceptor said, hey, I'll put 2 points in there for your pin-up, and they didn't, you need to show me a record of email before DC. Does that make sense? Okay. After DC, I lock them. You can't change any grades before. Cool. Okay. So take a look at your grade, make sure you're not missing anything that you did. If something wasn't added up correctly on a quiz, I need a record. If you come after you say with this, I need to email a record of it to the rest of the. Does that work? Okay, just so that's fair to say it. Last thing. Do folks still listen to Jerry? Do folks still watch Jerry Springer? He was like an OG government. But just including, even the most vigorous theological debates have an empirical side. And teaching that question is that there's empirical questions that there's the empirical data in some of these questions. The second thing I try to teach you is that it's very much be honest with yourself, be honest with the reader, and be transparent with what you're doing. Otherwise, you can do it. It's honestly been a part of this group. Also, there's Monday, finals, whatever the schedule, it's going to cover it as a school.